You said you're going to drink water. I was going to introduce them. All right, we're going to get started with our next session. Again, welcome to the LDT 2018 Fall Symposium. And we have a wonderful guest speaker today. He is a alumnus of the master's program. He's in a doctoral program now, and also works here at San Diego State in the Instructional Technology Services Department. Sean Hauze, let's give him a warm welcome.
Thank you, Rebecca. So today I'm going to be talking about some research we're doing here at Instructional Technology Services within SDSU, and also what I'm doing with my PhD program. So as Rebecca mentioned, I am an alumnus of the LDT Master's Program, and I'm super grateful for that experience. With Willie Olmsted here and a couple other students, I was able to go to China and do some beta testing of a mobile learning app. How's it going? Yes, awesome people there. Thanks to Minjuan for her connections. So I definitely recommend, for those of you in the program, take advantage of those opportunities that may or may not be available to you. And even if they're not available to you, like for example, we went to the Graduate Travel Fund office and kind of made our case, even though that wasn't explicitly presented to us. So it's really about kind of putting that foot forward for yourself. And also, I took advantage of 2 internship opportunities during my program. One at CipherWorks, which was learning design, more of an instructional design focus, and at Instructional Technology Services, actually with Rebecca's husband, James Frazee, where I now work. So definitely take advantage of those opportunities made available to you. A little bit of quick background. I started after undergrad working at Google as a 3D data specialist and started doing a lot of trainings for them, became interested in educational technology. I was then technology director at the Grauer School up in Encinitas for about 5 years, transitioned through the master's program, and I work here on campus now at ITS, Instructional Technology Services, and I'm pursuing a PhD in education with the joint doctoral program at SDSU and Claremont Graduate University. So as part of that, I've aligned the research that I'm doing with work that I'm doing at ITS, which is kind of the only way I've survived as a full-time student and a full-time employee, through the Virtual Immersive Teaching and Learning Initiative, where we serve 32 courses now with VR, AR, and mixed reality. So for the PhD research that kind of aligns both with ITS and with my dissertation research, we collaborated with the SDSU School of Nursing and with Pearson and Microsoft, and identified that there's a problem in the pipeline for nursing professionals in that there's projected to be over a 1 million person nursing shortage by the year 2020. And some contributing factors to that are financial resources at many institutions, scarcity of nursing faculty that are available to teach those courses, and clinical placements for the nursing students to be able to practice their clinical skills. So currently, simulation is used to address those shortages. They're used for practicing authentic, low-frequency, high-risk scenarios, and research has shown that they must be motivating for the students in order to be effective. Here's an example of current nursing simulation modalities. The issue is that there's an inequitable distribution of such simulation modalities because they're very expensive. So this is especially impactful for nursing students at institutions lacking institutional funding. And it's contributing to the nationwide shortage of nursing professionals. So this study examines the use of mixed reality and immersive simulation to address that gap through less expensive. So here's an example of a promotional app for anatomy simulation training using the Microsoft HoloLens, which is a mixed reality device. So simulation has been used for generations for teaching high-frequency, low-risk scenarios such as flying. So I would guess that every pilot out there, and the research points to this, has first stepped foot in a flight simulator before actually getting in the cockpit of the plane. So that's really, it ties to early constructivist theory, principles of active learning, and student mastery. And also within the nursing frameworks, Benner's novice to expert theory talks about integrating that real-world scenario to the education. So as I mentioned, there's a direct correlation between access to these expensive simulation modalities and the funding of the institution. So there's many institutions that are lacking funding, hence lacking access. One example is the Imperial Valley campus of SDSU. They have no simulation lab, whereas the SDSU main campus does have a simulation lab. So recent advances in immersive technology, as many of you know, VR is not new in immersive simulation in general. Second Life comes to mind. And some of these theories go back to the 80s and 90s, but recent innovations like the Microsoft HoloLens have made this possible both technologically and affordable with relatively inexpensive gear. So just 9 days ago, on September 20th, Walmart announced that they're going to be purchasing 17,000 or more headsets of Oculus Go, which is a brand new modality. I'm going to get into some of the prices, but for $199, this is actually Oculus Rift, which is what they tested on, because Oculus Go has only been available for a couple months. But yeah, so just 9 days ago, they're purchasing 17,000 headsets to train more than 1 million future Walmart associates. And this is, they're framing this from a 2017 case study involving 150,000 employees at 200 Walmart academies, where they observed increased evaluation exams for 70% of the employees involved. Overall, they determined a 30% higher satisfaction score among employees and 15% higher mean confidence score. And this is outlined here. So interestingly, Walmart partnered with Striver, which is based from a Stanford researcher named Jeremy Bailenson. So 150,000, and those are their findings. So it's really hitting mainstream. Also, I just got an announcement from Alaska Airlines that now first class is going to be equipped with headsets. So that's the kind of the entertainment side. This is the training side, and then Macy's is also doing sales now. Some of their more boutique kind of flagship stores. So it's definitely hitting mainstream in different areas. So given that, and one other thing I forgot to mention here is this confluence of satisfaction and confidence really points to the value expectancy model, which Eccles in 1983 pointed out that expectancy times value equals motivation. So essentially, how well you expect to do and how satisfying and how relevant it is to your experience indicates motivation, and that's what this senior director of central operations for Walmart pointed out, that they noticed that with those two factors, the employees were much more engaged in the training. So our research is framed in two theoretical frameworks. The first is the ARCS model, which John Keller first created in the early 1980s, which points out that motivation to learn, specifically with educational technology resources, is based on attention, relevance, confidence, and satisfaction, and that all four domains must be present in the instructional design in order for it to be motivating. Also, we relied on a similar framework from the National League of Nursing, specific to simulation, which also relies on confidence and satisfaction in order for the learner to properly learn from the motivation. So these two together, the instructional design component and the nursing simulation component, framed our research. So going back to that equity issue, these traditional nursing simulation modalities have been proven successful and have been adopted across nursing education, but they're highly expensive. So partial task trainers, things like the CPR mannequins that many of you have probably used, this example of an arm piece of mannequin used for practicing intravenous injection, it costs anywhere from $500 to $20,000. High fidelity simulation mannequins, which are essentially computers in a mannequin that can respond to tactile feedback, things like that, cost anywhere from $10,000 to $200,000. The ones we have here are about $90,000, and they require $30,000 per year maintenance schedule per mannequin. And standardized patients, which we at SDSU don't have access to, are kind of considered the gold standard for simulation, and they're actually actors that have makeup on to portray the different symptoms, and that requires a one-to-one interaction with the students at a rate of $20 to $40 per hour. So very expensive. Immersive technology modalities in contrast, are much cheaper. So virtual reality, most recently Oculus Go, and the new Oculus Quest that was just announced, range anywhere from $5 with Google Cardboard up to about $800 at the moment. Augmented reality, so think like your phone with an overlay of content, costs anywhere from $100 to $1,400. And mixed reality, like the Microsoft HoloLens, about $1,000 to $2,000. So the virtual standardized patient was created in partnership with the SDSU School of Nursing, with Microsoft in their holographic volumetric video capture studio up in Seattle, and with Pearson, who created the software. So I and the director of the School of Nursing traveled up to Microsoft and met with this standardized patient, a makeup artist, and a simulation lab director from Texas Tech. And Phil Greiner, our director of the School of Nursing, kind of directed this anaphylaxis scenario where in the scenario he was in a bicycle accident and had a laceration on his left shoulder, got stitched up, had painkillers and antibiotics introduced, and then was in the typical 30-minute waiting period to make sure there was no complications. And during that time, he exhibited signs of 3 phases of anaphylaxis. So the first was kind of hives, agitation, heavy breathing, and then he progressed through to passing out and dying. So in an actual nursing scenario, students should never see that. They should address that right at the first sign of hives and call the code and call the doctor, that kind of thing. But using the mixed reality headset, they're able to see the patient progress through those stages while wearing the headset and walking around the patient. In this case, you can see in the skills lab here at SDSU. So this was captured through volumetric video with 100 video cameras and 25 infrared cameras. And the result is a holographic model that the student can engage with and walk around and view from different angles. So we're dubbing this VSP, Virtual Standardized Patient. So the research questions that guided the study is, do undergraduate nursing students experience increased motivation to learn? And is there a difference across the 3 modalities of a written case study alone, a written case study plus 2-dimensional video delivered on a traditional 2D screen, and a written case study and 3-dimensional immersive simulation via the HoloLens? And secondly, what factors about those nursing students predict motivation to learn when the modality is the HoloLens? So the methods, we had 3 different levels of nursing students. So level 1 are students that have no clinical experience and are kind of at the first and second year level of nursing classes. The second level are medical surgical students who have some experience in the clinical setting. So they've had 1 or 2 sessions actually interacting with patients. And then the third level are often registered nurses who are coming back to get their baccalaureate degree, who have lots of experience. And so that sample of 161 students was divided amongst 3 different research groups. One got just the case study, one got the treatment with just the 2D simulation, and one had the 3D simulation via the mixed reality HoloLens. So each student completed a pre-survey so we could get information like how much experience they have in the clinical setting, how much experience they have with virtual reality and other immersive simulation modalities, how old they are, that kind of thing. And we also administered the Instructional Materials Motivation Survey, which was developed by John Keller to measure the 4 tenets of the ARCS model, and the NLN Student Satisfaction and Self-Confidence Survey, which is to measure that other nursing-specific measures of satisfaction and confidence. So, the findings. So you can see each one of these charts is case study, 2D video, and 3D HoloLens. So overall, I'm a mess, measuring motivation went up with each of those kind of treatments. So the case study alone, students out of 5 on a Likert scale rated at about 3.2 for just the written case study based on a series of about 36 questions. Higher, up to about 3.7 with the 2D video, and highest for HoloLens. So red X indicates that difference was not significantly different at a level of 95% certainty. So the red X indicates while it is higher, we can't confidently say that's due to the treatment. Same with the NLN specific survey questions. It was higher for the VSP, the virtual standardized patient, delivered via either modality over the written case study. But there was no significant difference between 2D video and 3D HoloLens. So if you break that down, the IMS down into the 4 tenets of the ARCS model, it shows there was a significant difference between all 3 groups with attention. So I'll get into why we think that's the case. There was no significant difference between 2D and 3D for relevance, but there was overall. There was no difference across the board for confidence as measured by the ARCS model. And same as relevance with satisfaction in that the VSP was overall better significantly, but not for 2D and 3D. So similar findings, satisfaction was higher across the board for the NLN survey, but self-confidence was only higher for the VSP in general, not between the 2 modalities. So those answer the first research question is, was there a difference between groups? For the second research question, we zoomed in on just the students that had the HoloLens, and we asked questions about what factors predicted. So this is the fun stuff you get to do if you do a PhD program. You get into the really kind of obscure stats. This is structural equation modeling, which essentially each one of these variables and factors, variables are represented in rectangles, factors are in ovals, are hypothesized based on the research to predict motivation and the tenets within motivation. So in this case, we formulated 2 factors through factor analysis and determined clinical nursing experience is based on the nursing level that they're at in school, whether they're at the satellite campus or the SDSU main campus, because the satellite campus caters more to students that already have nursing degrees, registered nurses, and clinical experience as in EMT, paramedic, other types of clinical experience. Participant age, as they reported, digital quotient, this was a measure that we administered to them, asking questions like, do you use Snapchat? Do you email every day? Do you have Wi-Fi at home? Things like that. And their simulation experience, and this is a combination of both the nursing simulation experience with those high fidelity mannequins and immersive simulation experience, like we asked questions about like Pokemon Go, that kind of thing. So these are the hypothesized factors that contribute, and when we ran regressions on all that, we found that only clinical nursing experience in the positive impacted overall motivation as measured by ARCS. So that means that students to a medium degree, 0.42 beta, were more likely to experience motivation if they had more clinical experience based on these contributors. For overall satisfaction and self-confidence as measured by the NLN survey, same predictors, and the ones that were, I mixed that up, but it was actually, in this case, it was participant age, so younger students were more likely to experience satisfaction and self-confidence. And if you break that down within the domains, confidence was impacted both by younger age and more clinical experience, which is kind of counterintuitive, and satisfaction the same. And then within, that's that slide that was supposed to be earlier, so this shows younger students overall have more self-confidence and satisfaction. And within the 2 domains, it matches as well. So, to summarize, simulation, the virtual standardized patient simulation via both 2D and 3D worked better within both measures than the case study alone. So in other words, introducing the simulation did improve their motivation across both instruments. Attention was improved specifically with the HoloLens, and there was no significant predictors within the different variables that we suggested, which means that young, old, very experienced students, inexperienced students all had increased attention to the same degree. And our hypothesis for that is that when you have something strapped to your head, it's not very easy to be distracted by other elements, you're fully engaged. So attention was kind of the main finding. Satisfaction overall was increased with the virtual standardized patient, and specifically in that NLN study, or instrument rather, it was increased with the HoloLens. And this is consistent with the findings that Walmart, over a much larger sample size, experienced. And overall, with the predictors, younger students with more clinical experience were more likely to find the mixed reality satisfying. And our hypothesis with that, even though kind of counterintuitive, is that younger students are more willing to try different modalities, they're more flexible in their learning schema, so they're more willing, but that more clinically experienced students rather have more context from which to derive meaning with the content. So limitations, this was first generation hardware, so that's the first version of the Microsoft HoloLens that Microsoft has released. And if you've tried it, and if you haven't, you're welcome to come by ITS, I can provide information on that, but if you've tried it, you'll know that there's kind of a limited field of view, so it's very realistic for about this much of your view, and outside of that you can see just the empty hospital bed. So undoubtedly that technology will get better, cheaper, lighter, not as heavy on your head, that kind of thing. Also, the software was just a prototype, so Pearson plans to develop this further with our suggested findings and with some qualitative research that they've done, but right now this is really the prototype software. Secondly, it's a relatively small sample size, so about 161 students is very small compared to the 150,000 that Walmart looked at. And that may be to blame for some of those non-significant findings. If it was a larger sample size, you may be able to derive more significance from that. And it was limited to just SDSU on the 2 campuses. And lastly, it was a quantitative approach. So we asked the questions of what are the differences, not why are there differences. Future research should be to expand to larger and other student populations, to include qualitative research in a mixed methods approach, and compare with the nursing simulation modalities like the high fidelity mannequins. So that is it. I think we have about 5 minutes for questions now, and you're also welcome to email me if you'd like to ask questions about this or come visit our Vital Lab here on campus. Yes?
Okay, just a simple question. I just saw you mentioned model, I think attention, relevance, confidence, and satisfaction.
Yep.
Is that the model from you yourself?
No, this is John Keller, the ARCS model. So I learned about that from Bernie Dodge.
Okay, it's just a learning model?
Yeah. So actually John Keller, interestingly, was Bernie's dissertation chair at Syracuse. He's now I think faculty emeritus at Florida State. Florida State. Yeah.
So I just want to know how to use it and what it stands for. Yeah, how to
ARCS, so attention, relevance, confidence, and satisfaction. If you Google ARCS model, you'll find tons of info. But essentially, what it theorizes is that the attention of the student should be grabbed either through inquiry arousal, so actually asking questions relevant and piquing their curiosity relevant to the content, but also perceptual arousal, so like having something strapped to their head that it doesn't necessarily relate to the content, but it captures their attention either way. Relevance, that it's relevant to the learner, so if they want to be nurses in this case, it should be relevant to the skills they need for nursing and they should feel that relevance. Confidence, that it shouldn't be so far out of their realm of understanding that they feel like, yes, I can do this if I stretch myself a little bit. There's lots of theory that goes into that one. And satisfaction, that ultimately it's like a satisfying, valuable experience.
it's just like a learning evaluation model, right? Something like evaluation.
It's a model of motivation, and that you should include these different components and elements within your instruction and training to motivate the learner in addition to improve the success that they're actually going to learn it and it's going to stick and they're going to retain it.
And there's implications for engagement and other things.
Okay, but because I've heard a model from I think it's called Crocker Portrait model.
Okay.
For model to evaluate your learning effectiveness.
Interesting. So the evaluation component to ARCS that John Keller built is that instructional materials motivation survey.
Yes.
But I'm sure there's lots of different types of evaluation.
Yeah, not the same, different.
Maybe overlap though.
Yeah, something overlap. I think it's interesting. For it's seem to motivate students
Yeah.
to, and that is to evaluate the effectiveness of English, of learning.
And there's a lot of research on motivation, and it's a particularly difficult field to measure because there's lots of factors, covariates
Yes.
that go into that. But in this case, in Kelly's case, it's more about learning asynchronously through instructional technology materials through kind of a self-directed model and the degree to which the student feels motivated while using that. So it's not about overall like student self-efficacy, that kind of thing. It's more about, to what degree does this modality or this piece of technology improve their motivation or decrease their motivation. Yeah, no problem. Any other questions? Yeah.
The title is deep learning. So what is your definition of deep learning?
Yeah, and to be honest, I think I was late submitting my proposal. I think Bernie put that on there for me. So I too was like, that's a little tenuous, but I'll go with it. So to answer your question, that was just kind of me not responding to the survey and being given the title to work with. Yeah.
So you have some examples of high fidelity
Yeah.
models. And it looked like you included that in areas of future research. Because I'm wondering if you foresee the ability to use, HoloLens technology or things like that for skills that require tactile muscle memory kinds of things like CPR or IV.
Yeah. And that's kind of one of the $1 million questions right now. And there's some limited examples of tactile feedback, like anybody seen Ready Player One?
Oh, yeah.
Yeah, the book's better.
Yes, it is.
Yeah. So anyway, in that movie, it sounds like he's the only one that's seen it. So in that movie, Steven Spielberg movie, it's pretty good. It's all right. The book's awesome though. But anyway, it's based in the near future, and the main character and others wear suits that they can engage and like interact with other players. So the answer is it's technically possible, and there are some limited tactile feedback. And the hardware is there. I think the software is just not there yet. So I think the two components that are missing right now from this technology is artificial intelligence. So you can, so in the case of the virtual standardized patient that we made, you can't talk to it. You have to like air tap to interact. Whereas a simple AI integration could answer simple questions like your Alexa does, things like that. And then to be able to actually reach out and feel the pulse. All physically possible, just hasn't been integrated with the hardware yet. But there's other opportunities for like overlaying video on physical mannequins, and that doesn't meet the need of that we set out to have a less expensive version, because then you need both to do that. But that I think would add to the ability of, with this, the heights can't get bigger and redder because it's just a static patient. But if you had a HoloLens on that mapped that object, which they do, they have infrared on the front of the head-mounted display, so it could actually map the model and have hives that go. I think we're right at time. One more minute. Any last questions about this? 2 more minutes. About this, or quickly I'll show the Vital initiative. So I'll show some of the use cases here on campus. So the fun thing about being in this field and having this degree is work becomes a lot more interesting in a lot of cases. So I get to help lead this Vital initiative. On campus, where we get to work with, at this point, 32 different faculty. So this is an example of a class called The Future, with Linnea Ziner, one of our humanities faculty, showing some different apps to her students, talking about like, what if we're all living in a simulation, that kind of thing. This is one of our learning research studios, similar to this room, but a little bit bigger. This is the gear that we support here on campus. And here's all the different courses. So it's really fun to be able to work with an interdisciplinary array. You can check this out on our blog at its.sdsu.edu. But it's in all 7 colleges at this point, ranging from 100-level Principles of Astronomy courses, where they're looking at phases of the moon in VR, all the way up to 700-level Doctor of Physical Therapy courses, where they're looking at like cognitive effects on Parkinson's patients by wearing tactile sensors and heart rate sensors and all that stuff, while simulating driving and other things with VR. So lots of different use cases. So it's fun to work with the subject matter experts via this and a lens. Last question? All right, thank you so much.